It's not, well, this is something for you, and we're giving up on you now. We're not giving up on these patients. We're putting everything into them to make sure that their comfort needs are met, that their families are being supported, that their emotional, spiritual, and psychosocial needs are being met. We use a comprehensive set of services that's directed towards meeting the goals of the patient. One thing I think that is most important for everybody to know about hospice is that while our patients are dying, they are still alive. They're still very much living. And we have goals for them, or they have goals for themselves. They have things that they have potential to accomplish. And we can help them accomplish that. I've had patients who have written books. I've had a gentleman who wanted to fix up his garage so his kids would have a play area. I've had patients who said, you know, I just want to be present with my life and my family. I've had patients who just said, you know, I want to go to Chuck Chansey Casino one last time. And we can help them with that. We can help them with that by giving them the tools to be able to accomplish what they need, by managing those symptoms and getting them comfortable, by giving them the medical equipment they can use, like you know, a wheelchair or oxygen, so that they can manage the tasks that they want to accomplish, by providing them with available resources that might be able to help them. So, you know, this is kind of the basic tenet of what we do. What we do is we work with the patient and family to develop a plan of care, and this includes our whole team: nursing, social works, chaplain, we have aides, we have volunteers that can provide any number of services for the patient and family. We have physicians on staff. The hospice will provide all the medications necessary to manage the comfort of the patient. And we also will provide medical equipment, medical supplies, and a number of other treatment and services too. It's all dependent on what that patient needs. And so it provides this really, I think, this wonderful service for the patient and the family. So instead of focusing on, oh my gosh, who do I call about this? What do I do about that? It takes some of the stress off of the family and saying, you know, I call the hospice. That's who I call when I have a problem. It kind of decreases all that stuff out there and helps put it into just one little bag for you to just kind of keep control of. And so it's just that one number to call. These are the people that will help me in this. Hospice care is available 24 hours a day, 7 days a week. There's a nurse on call 24/7. So, you know, at 3 o'clock in the morning when something scary happens, there'll be someone there for you. Let's see. I think one of the biggest things that we do is to teach the patient and the family, kind of to prepare them for some of the changes that they see. We really try to demystify the process of dying for these patients and these families. I look out in the room and I know you all are caregivers, and most of our patients live at home, and most of them are being cared for by family caregivers. And these aren't people who have been trained to, you know, be a nurse or a home health aide or anything. And they're doing this wonderful, wonderful thing. And I often think, gosh, if this was my, you know, if something happened to my mom, would I be able to drop everything and go provide that care? And people do all the time, and it's just this amazing gift for those patients. It really is. And so we feel a big part of what we do is to support that family and to make sure that you all feel confident in your role and that you are being given the information that you need to take good care of your loved one. I should put this slide first because usually I don't even get through and someone's going, who pays for it? Who pays? Yeah, I know this is really important. Hospice is covered by Medicare, Medi-Cal, most private insurance, and our hospice, and I think most of the hospices in the area, have provisions to provide care for patients who do not have a payer source at all. For those of you who have senior HMOs like Aetna Senior Advantage or Kaiser, those programs, that is actually hospice is carved out of those programs, and we bill directly to Medicare. So what that means is that you don't have to go through a utilization process or anything like that. Yeah, Medicare, there's no copayment, no deductible for hospice care. And I think, one of the really good things about this is nobody has to make a decision as to whether or not they can afford hospice care, because you don't have to pay for hospice care. There's no copayment, no deductible for the service. To be eligible for hospice, we're looking at a prognosis of 6 months or less. We see patients from just every diagnosis imaginable. Nationally, about 40% of hospice patients are on with cancer, but we see patients with cardiac disease, dementia, lung disease, kidney disease, multiple sclerosis, you name it, we can provide care for the patient if they are believed to be dying. We are looking at that prognosis of 6 months or less. Now, none of us have a crystal ball that says when that's going to be. And sometimes when we assess a patient, it's very apparent that the patient's condition is very grave. Other times, we just have to do our best assessment and say, yeah, maybe this patient fits within that 6-month criteria. For example, a patient with dementia, what we're looking at is when the patient stops eating or drinking, or when the appetite slows down, or when they're having trouble swallowing and start to have choking. We also might be looking at the patient being pretty much bedbound, functionally dependent for all activities. That's kind of the area we're looking at for a patient with dementia. Sometimes we admit a patient to hospice and they get better. And we can't say that they still fit within that 6-month time frame. And we can discharge the patients if that occurs. Patients also may choose to stop hospice if they want to pursue more aggressive treatment. In order to be on hospice, the patient and family has to have been informed of their prognosis and that they make the choice for hospice care. This is something they choose. We cannot make anyone get hospice care. One of the wonderful, wonderful benefits of hospice services is that we offer bereavement care, grief counseling for the survivors of our hospice families. Now, our hospice, many of the hospices provide this service to the community at large as well. And this is just such an excellent benefit because, when you've been a caregiver, when you've taken care of your loved one, when someone dies, there is a lot of grief associated with that. And it can be so beneficial to work with counseling to get through that process. Oops. What we want people to understand is that grief does impact the whole being, and it manifests itself in many ways. And this is important as caregivers to understand, that it does, and sometimes grief does occur before the death as well, that there is a grieving process that goes along with taking care of patients or families. But it involves the physical, mental, emotional, spiritual, and social aspects of your lives. And that's recognized.